My hospital took away all my drugs.
Well, that's interesting. Anyway, so this Reese was named after a patient named Reese, who's not my patient, but who came onto the same ward as this lawyer. She came in just kind of in a mixed state, very manic, yelling and screaming, and very depressed at the same time, and smearing feces everywhere, yelling and cursing. And guess what my ward chief said?
Pin her down.
Hold her down and give her the meds. She said, if you hold me down and give me the meds, I will sue you. I will sue you. Ward chief said, hold her down and give her the meds. You know, her judgment's shot. So we did the same thing as with the lawyer. But she was not my patient. But when she got out of the hospital, she wasn't shaking anybody's hand. She sued. And guess what? She won. That case is called Reese versus St. Mary's Hospital. And because she won, anytime somebody refuses meds, even when we're in the hospital, they have to have a Reese hearing. And she was in a mixed state at the time. So that's an interesting anecdote.
Yeah.
Once again, the differential diagnosis of the manic episode, if it is caused by an underlying medical condition, then it doesn't qualify. And if you treat that underlying medical condition, the manic episode will often go away. For example, Cushing's disease, which is your body putting out too much cortisol or cortisone, will often cause something that looks just like a manic episode. If you treat the Cushing's, it will go away. There's a bunch of them. I won't bore you. Strokes often do MS. Certain types of brain tumors. Once again, substances can induce something that looks a lot like this, like methamphetamine, cocaine, etc. You have to rule out those medical conditions. Now, as I mentioned, most people with bipolar type 1 have major depressive episodes in between the manic episodes. The vast majority. It's extremely rare to just find somebody with one or more manic episodes only, although I've seen it, and they qualify as bipolar. Usually they get depressed in between, and depression is just as nasty as in, one-way depression when people never get manic. And so a problem arises. As I said, most depression is treated by primary care docs, not psychiatrists, and not therapists. Your regular doc. So if somebody comes in depressed, the doc, until recently, was likely to just treat for depression with medicine. And if the person happens to have been bipolar and has had one manic or hypomanic episode, that treatment not only probably won't work too well, but might make the person worse. Because antidepressants in someone whose diagnosis is bipolar 1 or bipolar 2 can just bring on a manic episode or a hypomanic episode or something the primary doctor doesn't understand. And so there's been a lot of education to primary care physicians about screening for the presence of bipolar disorder. And it's been somewhat effective. A lot of the education has been done by drug reps trying to push medications for bipolar disorder, but trying to get the primary care docs to treat for it. And they often say, well, I don't know about bipolar disorder. So they're trying to teach them so that if they find it, they will prescribe the appropriate medications instead of just throwing an antidepressant at it, which is sometimes just like throwing gasoline onto a fire. Bad. So You can also have a mixed episode. If you had a mixed episode, at least one mixed episode, then you're bipolar 1, according to the DSM. A mixed episode is defined as meeting all the criteria for a manic episode and a major depressive episode at exactly the same time, concurrently. And it's pretty nasty. Very often the symptoms will alternate. You can be very depressed one minute and then manic the next minute. It's kind of hard to treat. Actually, best treated in a hospital if possible. I ought to mention something that I see a lot of, which is people who have something called schizoaffective disorder. Anybody ever hear of it? Probably heard of it. It's difficult to diagnose, and it's actually given to a lot of psychiatrists who are trying to pass their psychiatry boards. When you take the psychiatry boards, you've got to take a written test first, which is around 4.5 hours of psychiatry and neurology questions. Then if you pass that, you can go on to the oral test. The oral test is 2 parts. One part, 20 people sit in a room and watch a video. At least this is the way it was when I took it. You watch a video of a psychiatric interview, which on the surface seems like an excellent interview, but there's something wrong with that interview. And you got to tell the examiner what's wrong, okay? And then you go on to actually interviewing a patient in front of 3 or 4 psychiatrists who are administering the test. You interview the patient for a half hour. You're allowed to think for 5 minutes, and then you present the case to the examiners, who then grill you after you presented it. Tasty little test. And very often the video is of someone with schizoaffective disorder, which is a hard differential diagnosis and very confusing in the DSM-4. To have this, you have to have either a major depressive episode or a manic episode or a mixed episode, which I've defined. And concurrent at the same time, you have to have criteria that meet some of the criteria for schizophrenia, like hallucinations, hearing things that other people don't, seeing stuff that isn't there, smelling smells that other people don't smell, or feeling things that aren't there. That's a hallucination. It's a sense disturbance that isn't that no one else can sense. Or delusion, or disorganized speech, or catatonia. You have to have 2 or more of those things. And you have to have at least 2 weeks without any mood disturbance at all, where you have some psychotic symptoms. Okay? And you have to, for the predominant portion of the illness, have problems with your mood. The mood symptoms, they say, have to be present for a, quote, substantial portion of the total duration of the illness, which is where they run into problems, because they don't define substantial portion. Anyway, that's the essence of schizoaffective disorder.